Dr. Walid Ammar is the Director General of the Ministry of Public Health in Lebanon. That you all know. However, for the past 20 years, Dr. Ammar really has been the architect and the primary architect of the development of the health system in Lebanon. And he has been the driving force behind the changes from a traditional Ministry of Health to a Ministry of Health that discusses issues of relevance to public health. He has been also not only the architect, but he has also been the mentor of a large number of health professionals in public health, not only within the ministry, of course, but also within his role as senior lecturer at the Faculty of Health Sciences and his contribution to health development at the regional level in the entire Eastern Mediterranean region and the Executive Committee. Please join me to welcome Dr. Ammar, and thank you for joining us.
Thank you, Nabil, for your kind introduction. Dear colleagues, ladies and gentlemen, I would like first to welcome you and to thank you for choosing Lebanon for this symposium on NCDs and socio-political challenges. You are indeed in the right place. For years, Lebanon has been facing tremendous challenges and showed a great capacity to absorb constant pressures and shocks and to adapt. Recently, the escalating conflict in Syria gave rise to a continuous and massive influx of Syrians to Lebanon, representing currently 25% of its pre-crisis population. The chaotic distribution of refugees is constraining the healthcare system by a significant increase of demand for health services, competing with the Lebanese population on scarce resources. The Ministry of Public Health maintained its commitment to ensure to all residents, irrespective of their nationality, an equitable access to primary healthcare services. The primary healthcare network that has experienced a shortage in vaccines and essential drugs for a short period caught up quickly and is currently responding to a large extent to emerging needs. This is unfortunately not the case for hospital care, where the ministry restricts its coverage to the uncovered segment of the Lebanese population. Covering the non-Lebanese for hospital care is neither in the mandate of the Ministry of Health nor in its capacity. The UNHCR, responsible for financing hospital care of the Syrian refugees, reimburses only 75% of a limited package of services. Public hospitals are suffering the most because they are forbidden to deny admission to any patient in need for hospitalization. They incur significant losses that find expression in the inability to pay their staff salaries on time and to purchase needed medication and supplies. Nevertheless, the health system in Lebanon has been showing a great deal of resilience. All health institutions remain operational, and the Syrian crisis did not prevent the Ministry of Public Health from continuing the implementation of its reform plan, including the accreditation of hospitals and primary healthcare centers, and introducing innovative contracting methods based on hospitals' performance and quality of care. A particular emphasis was put on strengthening epidemiological surveillance and response, not only to prevent the spread of disease resulting from the overcrowding and the precarious water and sanitation conditions of the displaced Syrians, but also to face pandemic threats of MERS coronavirus and Ebola. Although preventing and controlling infectious disease remain our main focus to protect public health, NCDs are also considered of major concern. The Ministry of Public Health reimbursement of hospital care and expensive treatment for the uncovered population resulted in dedicating most of the ministry's budget to curative care, with the highest spending on treating NCDs. Our priority is to shift more resources towards promotion, prevention, early diagnosis, and early treatment by using essential, inexpensive generics. However, the government is put under tremendous pressures to procure the new generation drugs of exorbitant prices to treat few patients with cancer, multiple sclerosis, and rheumatoid arthritis. This situation is not specific to Lebanon. The importance of regulating pharmaceutical prices is common to all health authorities in developing countries. I would say, however, that developed countries that seem to be enduring the same problem are rather in a situation of complicity with pharmaceutical firms. I leave you with this thought and wish you a fruitful meeting.